world is facing a deadly and devastating global coronavirus pandemic.
While the COVID pandemic has taken over headlines, the opioid epidemic in America is getting worse.
The chances that you run into somebody with this problem and a potential overdose are actually pretty high.
Tonight on the 10, the hopes for a new vaccine to prevent opioid-related deaths, how it works.
Plus, the cutting-edge testing started right here in New England.
And reaction from a local mother who's using her heart-wrenching loss to help others.
It gives you hope. It gives you hope at a time when you desperately need the hope.
The 10 on NECN starts now. Well, Tim, in the past year, we have learned more about vaccines and the process to create them than most of us probably ever could have anticipated that we would ever know this much about. And while the entire world is really focused on eliminating the COVID-19 pandemic by vaccinating the masses, there is actually new vaccine research that could be a game changer for another major health crisis right here in America. I'm talking about the opioid epidemic.
Yeah, development of an anti-opioid vaccine started about a year ago right here in Boston at Children's Hospital. The goal here is relatively simple: to create a vaccine that can prevent death due to drugs containing fentanyl. And that's our starting point tonight.
So if she were still alive today and still actively using, this is a type of vaccine, given her history, that could be potentially life-saving.
So that's Melissa Weixner. She lost her daughter Amy to an opioid overdose 11 years ago. And sadly, Tim, she's not alone.
According to the latest numbers from the National Institute of Drug Abuse, one person dies every 8 minutes in the U.S. of an overdose from an opioid. The Institute also broke down the states with the highest number of opioid-related deaths per capita, and the research is shocking, especially for New England. 10 states with the highest death rates of opioid overdose: West Virginia first, Maryland second, and then you got New Hampshire at 3, after Ohio 4. You got Massachusetts, Connecticut, and Rhode Island at 5, 6, and 7. You got Kentucky in there too, but the last 2 New England states we haven't mentioned are in the top 10. Vermont and Maine rounding out that top 10. All 6 states here in New England are among the worst in the country. It is truly a health crisis, worsening by the second.
You're more likely to die of an overdose in the United States than you are to die of a motor vehicle crash. I mean, that's concerning.
Yeah, and just the idea that a vaccine could potentially bring down those numbers is really incredible. Usually people associate vaccines with infectious diseases like COVID-19, right? But this research at Boston Children's Hospital shows that vaccines may be a real tool for many different types of diseases, including addiction. And it's important to know that this vaccine would only target fentanyl. So you could still overdose from pure heroin or cocaine. But the problem is that fentanyl is often cut into a lot of different kinds of street drugs, both because it's cheaper and more readily available. It's also stronger, making it more lethal. Here's Dr. Sharon Levy, who runs the Adolescent Substance Use and Addiction Program at Children's Hospital.
For some people with opioid use disorder, it's used intentionally, right? Because they develop tolerance to opioids, and so they're looking for the next more powerful thing. Although, of course, it's such a powerful drug itself that they can easily make a mistake and end up overdosing without intending to.
So how would this vaccine actually work, right? Well, the first you would get that vaccine, you would be administered, causing the immune system then to make antibodies to the fentanyl. Then if that person takes fentanyl, the antibodies would bond to it and create a barrier, preventing it from reaching the brain. And this is the critical point, because what fentanyl does to the brain is it slows your breathing, and an overdose could stop you from breathing. This vaccine keeps people breathing normally, stopping the main cause of death. There's also work being done to make sure this vaccine is durable, meaning it will last for years and years. Now, you just heard from Dr. Sharon Levy. Her husband, Dr. Offer Levy, is leading the vaccine research also at Boston Children's Hospital. So I asked him if this vaccine could also make the drug less desirable.
It may have some effect on the high. We don't yet know all of that, but we are going to work first in cell culture systems. Then we're going to work with mice. And believe it or not, there are mouse models where the mouse can get addicted to opioids and self-administer the opioid in the mouse. And then we can see the impact of the vaccine on that behavior in the mouse, right? There's a lot of testing that has to occur, but the proof of concept is there, that these vaccines are able, at least in animals, to prevent opioid-seeking behavior and or overdose death.
The progress is there. It is great news, but the research really just in its infancy. And even though the COVID vaccines were developed in really a matter of months in 2020, most vaccines take many years to develop. Right now, Dr. Levy says they've begun testing outside of the human body, not on physical people. They're taking blood samples from study participants, doing research with that blood. And as you heard, they're also doing some research with mice. But this process far from over. Here's Dr. Levy on what he thinks would be a realistic timeline for the vaccine's development.
It's likely going to take several years. This is a 5 to 6 year project that will culminate in a phase 1 human clinical trial to be conducted at Boston Children's Hospital. The trial would be in opioid users. And we would look at safety and immunogenicity. We got to start with safety. Any new vaccine you develop, you got to show it's safe. And then immunogenicity, by that we mean how well did the vaccine induce antibodies and other immune responses that may be protective.
So this won't be available this month or even this year, but news of this research is really giving hope to so many. Now, earlier we introduced you to Melissa Weixner, the mom who lost her daughter to an opioid overdose. Now, this is a photo of her daughter, Amy. She was 20 years old when she died back in 2009. She was a bright young student who was pursuing a nursing degree at Boston College. She died 5 weeks after entering treatment for heroin use. And what Melissa didn't know was that Amy had been battling addiction for years, a revelation Melissa later discovered from the diaries that Amy left behind. She's since made those diaries and her message, her life's mission. She's sharing Amy's story and her perspective.
I have never met anybody who said, I want to be an addict. They are fighting this, and their rational brain may say, I don't want to be doing this, but their brain has been hijacked by the disease, and they're out of control. And so if we have something that can help give them some control, that might help them with other appropriate treatments to attain sobriety, that's what people want. That's what their families want.
Help is what these researchers and doctors are trying to do right now. This vaccine could give people who are in the throes of addiction a chance at sobriety. And that's critical, according to both Dr. Offer Levy and his wife, Dr. Sharon Levy, because she says that people who are actively battling addiction and are in rehab or seeking treatment are really the people who should be getting this vaccine first once it's available.
It would protect them from an accidental overdose, and that it's sort of the obvious folks to give it to. But I think that there are questions about whether there are other people who should get it as well. And that's part of the research that we're doing.
It is part of the research, and we're potentially years away from that, but it opens that discussion, right? Who are the other people that this vaccine could be given to? Well, that's maybe the more controversial part of this proposal. Dr. Levy there says because adolescents and young adults use drugs, they could be putting themselves unknowingly at risk. So she says offering the vaccine to kids isn't completely out of the question, which raises another important question, whether someone, especially someone young, would be more likely to experiment with the drug because they're now immune from a fentanyl overdose death.
I'm talking about kids who maybe don't have those addictions and protecting them as well. I think it's a reasonable question. Well, will that just, make them feel enabled and emboldened to go out and use substances? I think the answer is no. I don't think it will. Part of the work we're doing is trying to understand how people would understand this vaccine.
And Dr. Levy says 90% of adults who report serious drug use admit they first tried drugs before the age of 18. And we heard that in Melissa's story, too. Her daughter, Amy, first tried marijuana when she was 15, and her first time trying heroin was at 17 years old. And she says while this may not be for everyone, it could be a life-saving tool, especially with the threat of fentanyl being laced into all kinds of drugs like marijuana or pills.
And I do participate in a grief support group where, every time we meet every month, somebody else has had a loved one die in the epidemic. And these days, for everyone, it's fentanyl.
And sadly, that's the reality that Dr. Sharon Levy says she's been seeing locally as well. And national statistics show the pandemic is making the epidemic worse.
Now, according to the American Medical Association, more than 40 states have reported increases in deaths from opioids since the onset of this pandemic, just in the last year. A June survey of American adults released by the CDC found that 13% of people they questioned started or increased use of opioids to help deal with the stress and emotions related to this ongoing pandemic. Dr. Sharon Levy says at the end of the day, the program's ultimate goal, the research ultimate goal, is to save lives.
Well, I just hope that people will keep an open mind to it. These will be, at the end of the day, the goal is for us to be able to make some recommendations on who could benefit from this vaccine. But for each patient, it'll be an individual discussion with their physician to make the right choice for them.
And Tim, it's so interesting talking to both Sharon and talking to Melissa. The reactions that they are hearing from people who hear about this is truly emotional, knowing that hope could be on the horizon.
It is always interesting when we talk about Boston and New England being a hub for medicine, for hospitals, the research that they're doing, not everyone knows about. And it's amazing to know what's happening essentially in your backyard when they're working on this, even if it's just a couple of years away from now, potentially a life-saving measure that they're working on right now.